people tend to confuse UTI infection with STI infection, whereas these are two different infections. Whenever your partner hears of you being infected by UTI, they quickly jump to you having STI, where STI is a sexually transmitted infection. So they accuse you of having multiple partners. As we know, STI is passed through unprotected sex. Now, in UTI, this is not the case. UTI is a urinary tract infection where it's found in any part of the urinary system. Now, let's learn a little bit of urinary system, how it looks like. Urinary system have consist of kidney, ureters, bladder, and the urethra. These are the parts of the urinary system that will be affected by the UTI infection. UTI infection is mostly or commonly infects women more than men. Why? We'll get all those reasons why women are infected more than men. One of the reasons why women are affected more than men is their urethra is short. Length of the urethra. Women's urethra is shorter than that of men, where this short distance make it easy for bacteria to reach the bladder. That is one of the reasons that women will be affected more than men, but that doesn't mean now the men will not be affected. Another reason why women are affected more is the sensitive skin. The sensitive skin at the opening of the female urethra is thinner and more sensitive than other types of skin. This making it more sensitive to be affected by this infection. That is another reason why women are affected more than men. Another reason why women are affected more than men is the sexual activities. Sexual intercourse can cause bacteria near the vagina to spread to the urethra. That's another reason. Another reason why women will be affected more is because of use of contraception. Use of contraception is another way that women will be affected, and you'll keep on having a reoccurrence of this infection because you are treating the infection and yet is not disappearing. Why? Because you have the same method of contraception. Now, until you change this contraception method, consult your doctor. This is when now this infection will be cleared. Another reason why women are affected more than men is because of female urethra is closer to the rectum. In rectum, there is a harmful bacteria that causes bladder infection. That's why we are advised to wipe from front towards the backwards to avoid this harmful bacteria from the rectum to go to the vagina, where now it is spread toward the bladder and mostly to the kidney, which is at a high risk of your health. Now let's look at the symptoms of UTI. How will you feel like when you are having infected by UTI? One of the symptoms is pelvic pain. You feel pain on the lower belly, where the lower belly is having that pressure. You are pressured at the lower part of the belly, which is next to the pubic bone. This is one of the symptoms that you feel. Another symptom is there is a burning feeling while urinating. You will feel that discomfort, like a burning effect wherever you are urinating. Another symptom is there is always an urge to urinate oftenly. You'll feel urinating many times. And most of the cases, sometimes the drops of the urine will be coming out even without you visiting the toilet. So another symptoms is urine will have signs of blood. It will appear reddish in color in most cases, and the urine will not be clear. It will be cloudy than the normal urine. Those are the symptoms that you'll feel or you'll see whenever you are having infected by this infection. Another symptoms is strong smell in your urine. Your urine will smell stronger than that of the normal urine. Another symptoms you feel like this, uh, there is a pain that is not ending at your lower part of the belly. All this time you'll feel pain at your lower part of the belly, where now these are the symptoms that you feel now you having UTI, where you need to consult the doctor or you take measures on how to prevent or to cure. What are these now types of UTI? People have been knowing of one type of UTI, which is the bladder infection, mostly known, but there are three types of UTI. One of the type of UTI is the bladder UTI infection. How will you know that you are having bladder infection? One, there is pain while urinating. Another symptoms is the pelvic pain. You'll have pain at your lower belly. Another symptoms while you're having bladder infection is discomfort in your lower belly. You feel all the time discomfort at your lower belly. Another one is blood in your urine. You'll see signs of blood in your urine. That is the bladder UTI infection. The second type of UTI infection is the kidney UTI infection. Kidney UTI infection symptoms, you'll feel like you'll have high fever all the time or many times. Another symptoms when you're having a kidney infection of UTI is vomiting. You'll be feeling urge to vomit when you're having kidney infection, and sometimes you feel nausea. Another feeling whenever you're having kidney infection is the back pain. You'll have regular back pains whenever you're having kidney infection. Another third type of kidney infection is the urethra UTI infection. How will you feel like when you're having urethra UTI infection? One of the symptoms is discharge coming out from your vagina. There will be discharge coming out in most cases, more than often, more than normal. There will be that discharge coming out than the normal discharge. Another symptoms is there is a burning feeling of urine. You're feeling like you're burning while you are urinating. Those are the symptoms and the three types of urinary tract infection. Let's now look at the causes of UTI infection. What causes this infection? UTI infection is caused by bacteria that enters the urinary tract through the urethra, which now starts to spread to the other part of the urinary system, that is the urethra, kidney, and the other parts of the urethra system. Now, what causes this bacteria? What are the causes? What might be the causes of this bacteria infection? UTI infection. One of the commonly known in same causes of UTI infection is pregnancy in women. Whenever women, in most cases, are pregnant, they will be infected by UTI infection. Where now you are supposed to talk to your doctor, because when you're pregnant, you're not supposed to cheat yourself in a way or use any antibiotics unless prescribed by your doctor. Another causes of UTI is weak immune system. People that have weak immune system will be easy to be affected by the UTI, or it will be the currency of UTI. You'll keep on treating it many times unless now you find a way of regulating your immune system. Another cause of UTI is birth control methods. Women will have reoccurrence of UTI because of the method they are using to control pregnancy. This is now where you'll be treating and it will never fade. Why? Because you're using the same birth control method, where now, if it's the cause, you need to reconsider your birth control method. Talk to your doctor to change your birth control method that you're using. Another causes of UTI is having multiple sex partners. Remember, when a partner or another person you having sexual intercourse is infected by UTI, definitely he'll pass to you from the vagina, which will spread now to the bladder and towards the kidney. Another cause of urinary tract infection is patients who are having diabetes. Having diabetes can trigger to you having UTI, where until you are treated of diabetes, then the urinary tract infection will now be treated totally. Now let's now visit the how you can treat or prevent UTI. Remember, prevention is more than cure. One, avoid holding urine for long. Urinate frequently. Urinate as many times as possible. This will help to flush out the bacteria that might be forming in the bladder or the urinary system. Now, another way of preventing is use of water. Keep yourself hydrated. Drink as many water as possible so that you'll have that urge of urinating many times in a day, which now this helps to flush away the bacteria that might be building up. Keep yourself hydrated. Another way to prevent or to cure UTI is proper hygiene. Keeping your genital area clean is a good way of protecting infection to multiply or growth of this infection. Whenever you're visiting the toilet, wipe from front to backward. This will help the spread of this growth of bacteria. Another way or you can protect or prevent or treat this infection is proper hygiene during menstruation. Change your sanitary pad as many times as possible, or whenever you see now is full, don't take or stay with it for long because there will be buildup of this bacteria. And another thing is wipe yourself after changing the sanitary towel before wearing another one. That is advice in women. Another way is reconsider your birth control method. We have seen this is one of the cause that causes this infection. Reconsider the birth control method you are using in order to treat your UTI infection completely. Another way and the last way of now treating all this is the last option is by using medication. If this infection is severe, now you need to visit your doctor or the urologist to advise you on which antibiotics you are supposed to use to cure this infection if it's severe and you have tried all the above mentioned ways and still it remains in your urinary tract. Remember, after all this said, you are supposed or you are advised to visit your doctor or the urologist for more information. It's always advised in all the cases. Those are the UTI and the many ways and the different type of urinary tract infection. Remember to visit your doctor for more information. This is Liz Roberts channel where you'll get all the information that you need, and keep on tuning for the next videos and keep on supporting. I love you guys.